spending its time this morning adding to the political drama around the Affordable Care Act. There have already been over 40 hearings this year on the Affordable Care Act by House committees, 15 of those since open enrollment began on October 1, and now we can add the Science Committee to that list. While there certainly have been issues with the rollout of the website, the stories of how the Affordable Care Act is already helping millions of people are drowned out by the scare tactics used by my colleagues on the other side of the aisle. I have here the Republican playbook for undermining the ACA. It's filled with examples of how to scare constituents away from Obamacare. It's in the American people's best interest to encourage participation in the exchanges to help bring down premiums for everyone. But for my colleagues, it seems it's not about the American people winning, it's about them winning. This hearing is just another attempt to undermine the President's signature law and follow their playbook.
Mr. Chairman.
Well, I'd like to balance the record and share a little bit about. Mr. Chairman, I do not yield. I reclaim my time.
I'm not asking you to yield. I'm asking the Chairman to make a decision as to whether or not what you just did was impugning the integrity of those who are disagreeing with you on this side of the aisle.
Yeah, I say the gentleman from California.
Inconsistent with the rules of this committee.
I appreciate the gentleman from California bringing that issue up, but in the Chair's judgment, the accusation was general enough and not specifically addressed towards any individual, so I'm sure the gentleman will not repeat it, but I would not say at this point it was out of order.
Thank you very much.
Mr. Chairman. I'd like to balance the record and share a bit about how the ACA is helping my constituents. 24 of my constituents are uninsured. That's 175,000 people in my district alone. The Affordable Care Act will bring them, will get them covered so they don't have to worry about going bankrupt or being unable to get care if they become sick. Just yesterday, I heard from a constituent who lost her insurance when her husband became sick with Parkinson's disease at the age of 50. Now, through Covered California, she and her sons are able to get robust coverage, and they're saving more than $600 a year. Yes, the federal rollout has been complicated, and yes, we should be sure the website is protected from attack and Americans' personal information is secure. The law is about more than the website. It's about peace of mind for millions of Americans who need and deserve affordable coverage. Now, I've seen a lot of, I'm an English teacher, I've seen a lot of rhetorical, a lot of red herring rhetorical confusionist sort of statements and testimony being made. And I just want to clarify something with you, Mr. Kennedy. I have, you were asking, responding to, excuse me, before the hearing, you met with staff to discuss the vulnerability you found on the data.healthcare.gov site. In that meeting, you said that you could not, could not know what the architecture of data.healthcare.gov, what it was, or how it was connected at the systemic level with healthcare.gov. These are two separate websites. Now you are saying that they share an infrastructure. I'm not sure what you mean by that, but it implies that they are one and the same site. Now let me ask you a simple question. You could see the account information for data.healthcare.gov, a site that is not designed for consumers, but for researchers who look at national aggregations of data on health plans. Is an account at data.healthcare.gov also an account at healthcare.gov? Are they the same?
There's two questions there. The first is the account.
Are they the same? That's my question.
They're not the same.
Okay, thank you. Dr. Rubin, based on what you were able to learn preparing for this hearing, what are the vulnerabilities at healthcare.gov implicit in Mr. Kennedy's discovery about the data website managed by CMS?
It's really not clear to me. The data.healthcare.gov, I went to it and looked at it, and it's a different kind of a site. And I'm not sure. I'd need to study the linkage between, if there is any, the accounts on healthcare.gov and the accounts on data.healthcare.gov.
Okay, so Mr. Kennedy, do you believe there's any connection?
I do. I do believe that there's a significant connection. If you think of healthcare.gov, it's not just www.healthcare.gov. Think of a house where you have a door, which may be the entryway into it. There's things that support that website that pull data feeds in, and there's direct data feeds that get pulled in from data.healthcare.gov that are directly represented on healthcare.gov, information and statistics.
But are consumers going to be going to that site?
Not necessarily. I don't know enough about the infrastructure to say whether or not consumers.
So you
would be-
don't know anything about the infrastructure?
I don't know enough
Yet
about
in
the
your
infrastructure.
testimony, there's an implication that people could draw that there is one.
Well, there's over 100,000 individuals registered for that website.
Well,
it would be
I
indicative
think
that
this
it
is
is.
this is kind of an example of the confusion, this sort of testimony, a red herring to make the American people, to scare the American people.